A set of surgical lights fell from the ceiling of an operating room at United Christian Hospital and hit an anesthetic assistant 2 days ago. Subsequent inspections found problems with surgical lights of the same model at 12 operating theaters in the city's public hospitals. Secretary for Health Lo Chung-Mao called this severe and unacceptable and has demanded the hospital authorities strictly follow up on the matter. Sharon Tang has more.
The surgical lights in question at United Christian Hospital, according to the hospital authority, have been in use for about 11 years. Maintenance work was carried out just 2 months ago. Preliminary findings show the collapse of the lights had something to do with the condition of the screws. Speaking on a radio program, the hospital authority's senior engineering manager Yun Pak Leung said maintenance workers did look at the condition of the screws 2 months ago and will look into what went wrong. The hospital authority has completed inspecting surgical lights of the same model at all public hospitals in the city and found a total of 12 sets of lights having similar problems. The authority has commissioned an expert team to look into the case, adding the screws may have loosened because of metal fatigue. No patients were present in the operation room at the time of the incident, and no other medical staff members were injured. The bigger question is, what will happen if there is a patient underneath the surgical lights?
There's no feeling at that time when they do the surgery. If the weight of the equipment is 100 pounds, and then the falling down depends on the height. From there, it's only less than 0.7 meter. The weight will be 100 to 130.
Private hospitals are also on high alert tonight. The Hong Kong Sanatorium and Hospital said there are operation theatres equipped with lights of the same model. It added safety checks have been completed and no surgical operations have been affected. St. Teresa's Hospital also procured the same brand of surgical lights 2 years ago through the same contractor, albeit a different model. Preliminary checks did not spot any problems, and the contractor has been asked to inspect the hospital on Wednesday. Tony Ling, president of the Hong Kong Public Doctors Association, said this is an unprecedented incident which inevitably threatens the safety to patients and medical staff alike. Sharon Tang, TVB News.